Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this Parents and Caregiver series brought to you by Blue Shield of California's Blue Sky Initiative. Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Today, in one of our conversations in our Parents and Caregiver series, made possible by the support of Blue Shield of California's Blue Sky Initiative, we're talking about the intersections between substance abuse and mental health. My partner for today's conversation, marriage and family therapist and Brother Be Well clinical advisor, Christian Jacobs. Christian, I look forward to every opportunity to talk to you. Welcome back to Brother Be Well.
Hi, Michael. How's it going? Thanks for having me.
Really good, man. Let's get right on into this if you don't mind. Overcoming, as you well know, overcoming mental health conditions and substance abuse separately can be formidable challenges for individuals and families. But when you overlay one with the other, it can be a bit of a perfect storm, for lack of a better term. Can you please tell us about the ways in which substance abuse can and often does affect mental health?
Yeah, well, this whole concept. First of all, I think it's important that we address that there's a common misunderstanding that substance use and mental health are distant cousins, right? So they're separate. And even in our public health system and our mental health delivery system, they separate them. And things are changing now. But if you have a mental health condition, they send you to this clinic. They send you to this outpatient department. It's billed totally different. If you have a substance abuse issue, you are sometimes denied mental health services and are sent to a different location to treat that. So people see them as distant cousins when in reality they're brother and sister. Certain illegal drugs really, cause people with an addiction to experience one or more symptoms of a mental health problem. So mental health problems can sometimes lead to like alcohol or drug use, as some people with a mental health problem may misuse these substances too, as a form of self-medication. So that's very common. And really, mental health and substance use disorders share some underlying causes, including, changes in the brain composition. So for someone who's addicted to a medication or alcohol, that changes their brain composition, the size of the brain, the plasticity of the brain. And as a result, sometimes those genetic vulnerabilities or early exposure to stress and trauma, have an impact as well. So, there's also should have said this first, but there's also a cultural aspect where, and some drugs, are considered hard, right? We call them hard drugs. And certain cultures and communities are not really hard drugs. And some drugs are more acceptable than others. So you may grow up in an area where an affluent neighborhood where, cocaine may be used more frequently, where, it's more affordable. So there's different ways and cultural aspects in terms of that question as well.
It's not always, we're right. We're tracking as we always do, Christian, because you talked about drugs that are more accessible. It's not always those hard drugs that can cause the problems. Alcohol, right? And at least here in California, cannabis or marijuana, cannabis is legal here in California. Those are recreational drugs. And it's important that we note that we're talking about these as well. Are there other of those recreational substances that you can think of that should be on our radar as well?
I think for the sake of managing, we're looking at your mental health. It's really wise to be, cognizant of, all those drugs, of whether they're recreational or illegal, because at the end of the day, it alters your mind state. So that's what it really comes down to. It's like, how does it alter your mind state? And that's one, because substances, whether we're talking, about things that are necessarily seen as a drug, recreational, or legal, right? For that matter, someone who experiences severe anxiety related issues and they're taking high amounts of caffeine, which is, not considered a drug in some cultures. Caffeine is considered a drug, certain religious institutes. So, some that can raise, that those natural effects of sometimes THC and caffeine can make someone who's already anxious a little more anxious. So people should really to try and become aware of the natural side effects of a recreational drugs and some of the mood altering implications, a drug may cause. For example, like one who experiences psychosis, right? So if you have audio and visual hallucinations, you're experiencing, these hallucinations without drugs, and you decide to use a recreational drugs like shrooms, for example, that basically they're known for causing psychedelic side effects. That's where the issue comes into play. On the other hand, someone knows a hard drug and not really recreational, like fentanyl, for example, those are also potentials where hard drugs can be really mixed into some recreational drugs. So there's a lot to look out for when you talk about which drugs are, have more impact on your mental health and not.
It sounds like it. It sounds like we got to be vigilant and keep an eye on all of those substances that can and often do come into our lives. You touched on, I believe a second ago, drug-induced psychosis. So I want to get it right into that. It's also called stimulant psychosis. And it's very, very real, I've learned. Can you please tell us about it, Christian?
Well, a drug-induced psychosis occurs when basically someone uses drugs that possesses a mood-altering agent, such as weed, cocaine, alcohol, methamphetamine, and a person experiences these psychedelic, sometimes hallucinates, and these depressive symptoms and these anxiety symptoms that makes an existing mental health condition a little worse. So it exacerbates it really, and then you get into the clinical aspect. You're trying to find out what came first, the chicken or the egg. Are you having psychosis because of the drugs, or because you're experiencing other mental health conditions? So you have that issue as well. So drug-induced psychosis is often a feature of dual diagnosis. I'm not sure if that's been talked about yet, but a dual diagnosis, which is a co-occurring these mental health and substance use disorders, it's actually a diagnosis. So if someone comes in the clinic and they say, I'm experiencing schizophrenia, and I drink alcohol 4 times a day, maybe a pint a day, then now you're looking at a potential drug induced mental health condition. So that drug is the reason why that condition is happening.
What are some of the other drugs? I'm just listening to you and soaking it all up, Christian. What are some of the other specific drugs that can cause delusions or trigger those underlying mental health problems that we've been talking about?
Yeah, well, many drugs can cause psychotic symptoms, including some prescriptions. However, the substances that most frequently result in psychotic symptoms include, alcohol, which is a depressant, stimulants, and hallucinogens. So you have, we talked about before, the mushrooms. That cause you to hallucinate, and have audio and visual hallucinations as well. And so that's actually there's basically THC. Looking at that THC strain, whether it's sativa or indica, it can be a stimulant or a depressant. So back in the day, weed or THC was seen as, a depressant, because that was the main, symptom, lazy, don't want to do anything. People had, depressant symptoms. But now, as we're getting more into the science and seeing that sativa, the strain of weed, is much more impacts the brain psychologically than indica. Now, sativa can be seen as a stimulant and indica as a depressant. So that's another example of a drug that could be both. Meth and cocaine, that's a stimulant. Mushrooms and LSD are also known to have a hallucinatory side effects as well. So as you see, most of these drugs can either give you this euphoric feeling or a depressive feeling.
Yeah, yeah. Let me ask you the opposite question, the flip side of that question. What are some of the very specific mental health conditions that can be complicated by some of these substances?
Well, the short answer to this really is any mental health condition has the potential to be complicated or exacerbated by substances. Drugs affect each person differently, so it's hard to say to what extent will each drug impact someone's existing mental health condition. Um, Sometimes you can see which person be more susceptible to, based on their history and their traits, things of that sort. For example, ADHD. People with ADHD basically may be inclined to abuse drugs sometimes, or alcohol to make up for that lack of dopamine in their brain. So someone who's not aware or doesn't have that insight and has ADHD, many individuals, may seek either caffeine, which is a stimulant, or some other drug because they have that lower level of dopamine, that good feeling, that chemical that you need when people don't have, when it's not functioning properly in their brain. Also, treating ADHD and substance abuse can be challenging because medications used to treat ADHD can also be habit forming. So Adderall, Ritalin, these are all stimulants. These are all methamphetamine. So basically, some of those can be very addictive as well. But there are several other mental health conditions where people are more inclined to use substances to alleviate their mental health symptoms. Someone who's a borderline personality disorder, bipolar, anyone experiencing psychotic features, anxiety, and depression are usually that candidate or that person in that circle to really more than likely sometimes step out and use something to self-medicate.
I'm so informative. The information that you're giving us, Christian, really really appreciate it. I almost skipped this question when I put this conversation together because it seems obvious to me the answer, but it might not be so obvious to someone listening or someone watching. Do
Mhm.
drug-induced mental health disorders really require treatment, or is it as simple as stopping the drug use? And where I'm coming from there, if it's drug-induced, one might say, well, the drug is driving the mental health problem. So if I can stop the drug, I don't have to treat the mental health disorder. What's your take on that as a marriage and family therapist?
Well, in terms of drug-induced mental health disorders requiring that treatment, and really considering is as simple as one stopping the drug use, as we were talking about before, it's really coming down to what is the existing issue, what is the underlying issue, and which one is more prominent. So that's the first thing we want to do clinically in terms of assessment. So you're looking to see if this person stopped using alcohol, or if we got them to wean off of alcohol for a while, do their symptoms decrease? So that's the first way to look at it. And then really medically supervised detox, which is most of the time needed when there is some type of addiction to where the patient needs more assistance. So, and detox would be the first, another component amongst group therapy and individual therapy, but it's really preventative when you're looking at detox. And more severe symptoms such as psychosis, through the use of common medications or tapering off the substance. That's the issue, where you can't just quit cold turkey. So you have to sometimes take certain medications to help wean yourself off of certain drugs. And once the initial detoxification is complete, then psychosis should not be an issue. However, sometimes it is. So that's where you go back to the reassessment. However, relapse is another thing that should be talked about too, and the necessity for another detox, really can increase the chances of psychosis too. So it can appear as a symptom from withdrawing from that medication. So really, when we look at it, so detox is the way to go, but there's also done an inpatient facility or outpatient program. They have something called IOPs. It can be done in those situations as well.
And we've got separate videos on the Brother Be Well platform talking about inpatient and outpatient facilities. So go to brotherbewell.com if you want to check out some detail on what Christian just shared there. Appreciate that, Christian. Let me ask you about the treatment then for co-occurring drug abuse and mental health conditions. What does that if you can, what do the nuts and bolts of that treatment look like?
Well, it's kind of when you're looking at one patient, it's sometimes different when you're trying to create a standard or create some type of baseline for how it's going to be every time. So it can really look different for each person. But when referring to like culturally competent services, so you have your standard services and you have culturally competent services too. It may look a little different. It also may involve more of a systems approach, meaning involving the family and the others into treatment to educate them on their loved ones, their condition, their coping mechanisms, things of that sort. So that's when you're looking at more culturally competent treatment. Also, we're looking at engaging clients and providing a realistic picture of how treatment may look over the weeks and months too. So you're sitting people down and showing them, hey, you may be in a locked facility, for the next, 8 weeks, and you may not have access to your cell phone, things of that sort. So these are the step approach, when you're really helping someone transition them to therapy and treatment. Also using culturally competent screening tools. So eventually you'll be screened, taking maybe it could be like an alcohol assessment, a drug intake assessment to see how often you're using to really work out your treatment plan. And then using, that team. We're gonna have a team of doctors and psychiatrists and psychologists, therapists and counselors. Your substance abuse counselors. You may have one of your family members come in and help you out. So you have several different components to it, and also one thing you want to do in the assessment part is assess for their motivation to change. So if they're not motivated to change, you're really wasting your time in a sense, because that first step is them having to step forward, be ready to make a change, and really assess if they're able to go through these steps or not.
Really appreciate you walking us through all of that, Christian. It takes a village. You just described a village that helps someone get back healthy and get back on their feet and moving along with their life. The Brother Be Well family is a bit of a village too, and I want to thank you for being a part of this conversation. Christian Jacobs, marriage and family therapist and Brother Be Well clinical advisor. Thank you, sir, for being with us today.
Thank you, Michael.
And I also want to thank our sponsor for this conversation, Blue Shield of California's Blue Sky Initiative. That initiative boosts access to mental health support. That initiative, in fact, sponsors all of the Brother Be Well Parent and Caregiver series of videos and podcasts. So we want to thank Blue Shield of California for that. You can learn all about that initiative at bluesky.blueshieldca.com. That's bluesky.blueshieldca.com. Another quick website I'll give you, keep it in mind as well, brotherbewell.com. If you like this video, go to that website. All kinds of videos similar to this one, audio podcasts, print pieces, incredible stories, personal stories of strength and resilience. Every resource we can come up with that you need to be well is right at that website, brotherbewell.com. We're a membership supported service, so if you can join us as a member, that'd be great. But if you'd like to start out a little more slowly, give us your email address. You'll sign up for our blog, and 2 or 3 times a week, you'll get notifications in your inbox about videos and podcasts that go live, just like this one. So again, that website, brotherbewell.com. My name again, Michael P. Coleman, Content Director for Brother Be Well, asking you to do 2 quick things for me. Take great care of yourself, and then take great care of somebody else. Until next time, bye-bye.